Good morning. In the interest of time, because it's Saturday and we all want to get out of here earlier than expected, hopefully, I'm going to start the session. Couple of comments about this session. We're going to have a first and second half. They're going to be separated by a Q&A session where we try to show you a few questions of the Fuse exam and give you kind of a feel of what kind of stuff we're asking if you go to the Fuse exam. There's a system that's iPhone or cell phone based, and there will be a slide with a number that you can put into your phone, and then we can look at the aggregate answers to the question on the screen. So when the time comes for the Q&A session, please watch the screen, put in your number, and then you can vote which answer you think is the right one. This also works for questions that you want to bring up to the podium, but it's a small group. We have microphones, so we'll open it up for a few questions if we have time. Can I have the first slide, please? There we go. So this is the fundamental use of surgical energy preparation and refresher course. This afternoon, there is the opportunity for whoever wants to sign up for the Fuse certification course test. There's 8 more slots open. So those that have not planned to do that already, if you want, you can take the Fuse certification test this afternoon. And there will be somebody in the room at the end with whom you can sign up. I'm going to read you an email that I just got this morning from the Kaiser Permanente system where I work. And it says, it's from the chief of cardiothoracic surgery at the big LA hospital where our residency program is. To the group, in light of the recent flame-ups and the fires related to electrocautery and surgical sponge lap pads, I hereby am requiring that all surgeons and surgical PAs complete the attached course through the SAGES website, which is the Fuse course. I realize that it is unclear why we've had a cluster of these fires, and there are many concerns that the electrocautery devices are highly variable and more sparky in the past year. Regardless of the fact, it is incumbent upon us to understand the technology that we are using and control the environment in which we use the device that could initiate an OR fire. So this is 2016. So I'm going to introduce this course. I have no personal disclosures. My name is Pascal Fuchshuber. I'm a surgical oncologist at the Kaiser system in Northern California. We all started, like most surgeons today still are, we didn't know that we didn't know surgical energy. Before you heard about Fuse, most of us, including myself, really had no idea that we were missing something, that there was a gap. And then we went to the second stage, which is where we realized there was a gap. So I know that I did not know surgical energy once I saw the Fuse curriculum. And hopefully by the end of this day, as many as possible in this room will have taken the Fuse test and be masters of surgical energy. In other words, they will know that they know what we need to know about this issue. It started basically the moment we had the first energy device in the operating room, and I'm going to show you this short little clip. Can we have some?
Dr. Chickering will now cauterize the end of the duct. No flame needed. But does it make toast? Very good. Get it off! Get it off!
Burning! Burning! No self-concealing.
Respond! Don't!
So everything you need to know about surgical fires and energy, this is 1921. This is the first electrosurgical machine by Bovie. That's actually a realistic reproduction of the model that is in a museum a little bit north of here. But essentially, in 1974, a nurse got electrocuted in an American operating room from a faulty EKG circuit. So these things don't happen anymore now. We have moved to laparoscopic surgery, very, very different field, same problem. So this is Senator Murphy, who died from a intestinal leak from an inadvertent burn during a cholecystectomy. Today, we disfigure beautiful human beings for life with 100% preventable operating room fires. Not here, not me, no way. Think again. These things happen. And the results, if the patient survives, still are devastating. So why fuse? Well, there's still hundreds of OR fires annually in the United States, and 2 to 5 unnecessary deaths every year. 40,000 patients, that's the number we know, get burns due to electrosurgical devices annually. And the monies we pay for those pale in contrast what it cost you to become certified in Fuse and to have this program. So I'm just going to throw out a couple of questions here. You don't need to answer them, but just start thinking. Cautery is a subset of modern radiofrequency electrosurgery, yes or no? Which of the following increases the risk of capacitive coupling during laparoscopic surgery? And the coag mode on your surgical device, what does it do? What is it made with? Let's face it. Would you go on an international transcontinental plane if the pilot told you he had never seen this plane or flown this plane before, but everything looks the same as with the other plane he just flew yesterday? We do that pretty much once a month at least in the operating room when industry comes with a new device and the patient is asleep and we just try it out. So the Fuse educational program is, as you probably, how many people have done the online curriculum in the room? Show of hands. Anybody hasn't done it yet? Good. So that's the online curriculum. It's a free online curriculum you can get through the SAGES webpage. It's a 10-hour program, educational program. We have the SAGES manual on Fuse. And let me just give you a quick intro in what the Fuse online module looks like.
For safe and effective use of electrosurgery, it is important that the user possess a clear understanding of the principles.
So there's a bunch of slides on this first module. You go through the slides.
What is radiofrequency
They're basically
electrosurgery?
multimedia
It's
with
the
video,
intracellular
voiceover.
conversion of
There's CME
electromagnetic
questions at
energy
the
to
end.
kinetic energy to thermal energy.
And it's
There are
10
two
chapters.
conversions that occur.
And it's free for
This
everybody to
thermal
do. And
energy
I
then
highly
creates
encourage
effects in the
those
tissue,
that want
such
to
as
take the test.
vaporization,
We can stop the
coagulation,
audio now.
or fulguration. It is not cautery.
Turn it down. To take that as a preparation for the test. If you do this a couple of times, you'll pass the test. So I want all of you in this room that aren't certified yet to have this on your wall by the end of the year. There are many test centers in the country. Our Fuse office can direct you to those, but I would like your name on a Fuse certificate that basically validates that you understand and know the knowledge to prevent those kinds of emails that I just read to you. Thank you very much. So we're going to start with the first most important talk, I believe, which is Fundamental Principles of Radiofrequency Electrosurgery by our expert, Malcolm Munro from Kaiser Permanente. Malcolm, thank you very much.